Perfect. Let's go on like that. Yeah. Thanks again very much for the invitation. It's a great honor to be here and to follow up on Roger Ulrich. So we are Isabelle Boucq and Laure will speak next. The program today is going to be, for my part, to talk about the roots of horticultural therapy and present some key programs, talk about the obstacles to recognition of this intervention, the role of our association, which I will present, and to finish with 3 testimonials of members. Just to introduce myself quickly, I trained in horticultural therapy in the US at the Horticultural Therapy Institute. I wrote a blog for about 12 years now in French about horticultural therapy. And I was one of the co-founders with Laure and several others of this Fédération Française Jardins, Nature et Santé, and I was the first president. And also I happen to be a clinical psychologist. Some programs can be found as early as 1975. It was a psychiatric hospital which asked the head gardener to build a lot of green spaces for the patients to make it a therapeutic environment. And another program started in 1983 where mental health patients who were stabilized and had left the hospital could join a rehabilitation program based on horticulture. So here are a few more current programs that I wanted to present. The first one is in a Paris hospital for children attending a psychiatric unit, and it's a program that has been started in '97 by Anne Riebe. You see her there in yellow, who was a nurse who became an horticultural therapist. Another interesting example is a unit for patients with dementia in a hospital in the east of France. The program was started in 2007, and the garden is accessible to the patients, the families, and the staff. The neurologist who started this program has published several studies in France about the reduction of burnout for staff, for example. Another program is in a residence for people with brain injuries that's taking place outside of Paris. The garden has several functions, and it was co-created by the resident and the staff member who's a certified medical assistant. The fourth example is a garden that was inaugurated in 2023 in a clinic in Paris, which has both a maternity and a palliative care unit. It's a garden for women in labor, and also patients in their beds can be taken to the garden. Another kind of garden I wanted to mention is therapeutic gardens outside the walls, not in an institution. For example, the Jardins de l'Humanité is a multi-purpose garden who has children, adults, older adults coming to the garden. The second example of that is a program called Terr'Happy. It's a garden that was created for people with chronic diseases by a group of doctors who wanted to provide their patients with physical exercise, horticultural therapy, and nutrition advice. So all those programs I should mention are led or were designed by members of our association. So in France, there are some obstacles to recognition. One of them is that there is little awareness of horticultural therapy. 10 years ago, but now we see an interest in nature-based intervention accelerating in the past 3 or 4 years. Another obstacle is a perceived lack of scientific studies to back the benefits of horticultural therapy. And it's true, there's only a few studies done in France and published in French. So the two other obstacles are the lack of training. Since 2012 or so, there's been about a dozen short training modules. There is now, since 2021, a continued education degree created by a medical school, and we'll talk about it a little more. But there is no formal horticultural therapy degree yet in France. So as a result, there is a lack of a professional status since there are no official horticultural therapy title in France. There are a few milestones that we can mention. Jardins et SANTÉ is an association that has been raising funds for therapeutic gardens and also organizing international conferences since 2006. Another milestone was the publication of the first manual about horticultural therapy in French, published in 2017 by Jérôme Pellissier, who's a doctor in psychology. So in 2018, this association was created to bring together allied professionals. It currently has 130 members, and they come from different walks. They come from health professionals, doctors, psychiatrists, neurologists, nurses, physical therapists, and several psychologists. And also people from the horticultural professionals, gardeners, landscape architects, and others practicing ecotherapy or other associations that wanted to join. Here are our missions: to raise awareness about nature-based interventions in favor of global health within the general public, within institutions, government agencies, and healthcare professionals. And also two other missions: to contribute to the development of therapeutic gardens and other nature-based interventions, as well as to provide resources and networking opportunities for the members. We'll now go into 3 different testimonials of the members of the association. So you can meet here Florence Gottigneau, who's chatting with Roger Ulrich at a conference in France in 2019. She's a landscape architect as well as a trainer or teacher of horticultural therapy. Here are a few quotes she has about what is important for her in therapeutic gardens. The garden needs to respond to different physical and mental states with intimate spaces and collective spaces. People need the opportunity to be active or to just be in the garden. Another important point is the conception must be participative, with some time immersed on the site, speaking with the residents and exchanging with the staff, then offering training for the staff. And another important thing for her is no 2 gardens are the same. Let me introduce you to another member of our association called Jérôme Roussel. He's a dedicated staff member in a psychiatric hospital doing horticultural therapy sessions. So this psychiatric hospital near Paris, called Théophile Roussel, started a program, a garden, in 2017. It's called the Jardins des Tisanes, and it offers an horticultural program that was started with the full support of the medical staff and the management of the hospital. And it's now employing, it's been employing for several years, this dedicated part-time professional, Jérôme, as a jardinier médiateur. So here are a few things that Jérôme wanted to share with us. Participating in the staff meetings enables me to share my feedback with a medical team, as well as to learn firsthand about the various disorders and condition of each patient. Last year, I received an introduction to mental health and psychopathologies. Coming after several years in the position, this training allowed me to make connections based on my experience. Each year, I strive to study a new field to enrich the range of my proposals. It can be bird watching, composting. And here's the last example from Dr. Romain Pommier, who's a psychiatrist very involved in horticultural therapy. Thanks, Laure. So he was working as an intern in the Saint-Étienne University Hospital in the psychiatric unit in 2015 and started the Jardins des Mélisses, which now offers weekly horticultural therapy sessions led by trained medical staff. And we'll talk about the study based on 200 patients. There are a few things that Romain wants to say. So a nurse has been working now part-time on this project, which is giving it a real sense of direction and continuity. A nurse-led research study on the impact of a garden versus treatment as usual was published in 2024 and showed a positive impact on anxiety, meaning that patients going to the horticultural therapy sessions were able to reduce anxiety, and we can give you a link to the study. So in his opinion, research must use mixed qualitative and quantitative methods to evaluate correctly what works and what doesn't. Okay, so yeah, a couple more things to say.
Я хочу додати ще декілька речей.
Right. So to raise the profile of the healing gardens at the university level, we created this degree I was mentioning earlier. It's called the Diplôme Universitaire. The title is Santé et Jardins, Health and Gardens, to share the state of the art in this field. I just want to point out a Diplôme Universitaire is a degree for professionals already in the job. It is not a university degree like a bachelor's or master's. My goal is for healing gardens to be recognized as a non-pharmacological intervention in collaboration with the NPIS, the Non-Pharmacological Intervention Society. So in conclusion, he says, it's now more than a ripple. General practitioners are taking up the subject of healing gardens. Just in conclusion of my part, before letting Laure do our presentation, I wanted to mention that two French-based horticultural therapists, members of our association, but trained in the US and in Austria, participated in training local psychotrauma therapists in Kurdistan in, I think it was, 2021, in the use of therapeutic gardening with war refugees. It's one example that I could give to you from work here.
Yeah.
So thank you, Alexandra. Laure, over to you.
Yeah, thank you. Thank you very much, Isabelle. So hello, everyone. I'm very honored to be part of this colloquium today. I am Laure Bentze, and I'm a French practitioner and trainer in horticultural therapy. So today I'm going to talk to you about a particular way of practicing horticultural therapy that is based on a person-centered approach. So here's the overview of my presentation. So after an introduction, I will present the essential points to remember about the person-centered approach, its contributions to horticultural therapy, and then I will develop 2 examples before coming to the conclusion. Then we'll leave some time for questions that Isabelle and I will hopefully be able to answer. So I have to mention that I don't, and my colleague doesn't have either direct experience with war veterans or PTSD, but we believe that our experience and way of practicing is completely transposable to people with war trauma. So I'm going to introduce our organization. It is called Terr'Happy. It's a social enterprise created in 2016 based close to Paris. And our mission is to improve health and well-being with gardens and garden-based activities. So as Isabelle said earlier, we are also founding members of the Fédération Française Jardins, Nature et Santé. So we are a team of 2 co-founders. So you can see my colleague Stéphanie Persson and myself on the picture. And we are both practitioners and teachers in horticultural therapy. We often include colleagues in our teams, in our project, and also we have healthcare professionals who are also teaching in our training programs. So our activities are threefold. The first part is about creating gardens. We've created about 40 gardens in around Paris. We also run programs in horticultural therapy. So it can be programs for old people, for cancer patients, for people in social isolation, for a large variety of people. And last but not least, we train people to practice horticultural therapy. So half of these people are healthcare professionals or social workers, and the other half are generally people undergoing retraining. So the next 3 slides will illustrate the importance of training in horticultural therapy. So as Isabelle mentioned earlier, there is no official horticultural therapist title or training in France that would be recognized by health authorities. So my colleague Stephanie and I, when we started, we had degrees in plant science and in ecology. So the question was, how could we practice horticultural therapy with this knowledge and skills? So the first solution that we found is to work with people who had complementary skills to what we knew already. So we gathered this team. You can recognize some of the members. So with this fine team, we launched our first training courses, and each of us could teach our own field of expertise, because horticultural therapy, of course, needs to bring together different kinds of skills and knowledge. So actually in France, you can find some horticultural therapy programs that are run by a collaboration of plant specialists and healthcare professionals. So the next step was to get trained in the field of therapy ourselves. So I took a class in horticulture as therapy run by Mitchell Hewson, who's a pioneer in Canada. And my colleague and I also started to train in person-centered therapy. So this is what I'm going to develop now, explain to you what person-centered approach or therapy consists of and what are its contributions to horticultural therapy. So the basic characteristics of a person-centered approach are as follows. First, it was developed by Carl Rogers, who's an American psychologist between the 50s and the 80s. It's a humanistic approach, often taught in the fields of healthcare and social work, And it is based on the assumption that only when a person is accepted as he or she is, can he or she experience change. So to put this approach into practice, you need to adopt 3 attitudes, just 3, no more. So the first one is called empathic understanding, and it refers to understanding the client's internal frame of reference, the way he or she sees life in general. The second attitude is unconditional positive regard, and it refers to a complete acceptance of the clients as they are. And the last one is congruence. It's a synonym of genuineness, and it means that the therapist must be genuinely himself or herself. Person-centered approach is based on a relationship of trust. It is very versatile and suitable for all categories of people. And another interesting quality is that it does not require detailed knowledge of the person's history or pathologies. So what are its main contributions to horticultural therapy? So first thing, there's a strong focus on the person's real needs and capabilities, and not on the theoretical needs and capabilities of a person. Secondly, the principle of empathic understanding guides us throughout a session. And here maybe I'm going to develop a bit. So for example, we will always suggest activities that are completely appropriate to a participant's present state. We let ourselves be guided by the participant's needs and desires, and we support those needs because they are a sign of the expression of the life impulse of the participant. We always respect the participants' tastes, choices, and we never impose our own. We always remain positive, non-judgmental, and we do our best to foster trust. And I'd like to add that what counts for us are the resources of the participant, not the deficiencies. And we're trying to identify those resources, develop them, and for that we need to interact often and stay connected with the person. So now we're going to move to the first example. It's a palliative care unit in a hospital. Sorry, it's a palliative care and chronic pain management hospital unit. So to give you some context, we started this project in a very small space. As you can see, it's a small garden, mostly made of raised beds. And we also have trained a team of about 10 health staff members, of which most of them are nurses, but there's also a doctor and a psychologist. So the training was spread over 6 months in 2024. And during this time, we encouraged the trainees to practice independently between training sessions. So here are the main needs and goals that were identified with the team. So the first one is, of course, pain management, but in a non-pharmacological approach. The other goals were helping patients going outside and breaking out of isolation, because most of these patients are reluctant to go outside because of their disease and pains. Another goal was to help the patients to rediscover pleasurable and positive sensations in their body, because they usually experience mostly painful sensations. And the last goal was to help them restore their confidence in their abilities and autonomy, because usually they have lost confidence in the possibilities of their bodies. So for the setting, it was either an open group setting or individual sessions. So here's the outline of a typical session. So we would start with a welcome time. During this time, each participant would share their current emotional state, but it had to be kept brief. Then we went to explore the garden, and especially use all our senses to explore the garden. Then we had activity times, and the activities had to be kept simple and low effort so as not to trigger new pains. And then, of course, any initiative from a participant was always welcome to foster autonomy. And then we always had a closure time when we shared a cup of herbal tea, and it was very important to express appreciation for the benefits of the session during this time. And they could use that at home too, so we helped them in that way. I will explain later. In this case, the person-centered approach has allowed patients to participate at their own pace and according to their abilities. And they are all different, so it can help each participant to be able to do something and be active in the garden. Another interesting aspect is that it helps patients to discover that contact with nature can help relieve pain. So here is some feedback and observations made by the nurses over this period of 6 months. So sensory stimulation with plants and nature is very important because observing, touching, and smelling plants allowed patients to shift their focus away from pain. It was observed also that patients often forget about their pain during the session. They would do things that they would normally don't do outside of the sessions. It was also very important not to mention the topic of pain, because even a simple reference to pain can cause the patient to spiral back into thoughts about it. So nurses found out that it was very helpful to go to the garden before painful treatments because patients had less apprehension about these treatments. It was also important to have takeaways after a session because, for example, if they took some little plants back home, they would continue to take care of the plants at home, and it was a continuity between the sessions and the daily life. Some strong emotional responses were observed, for example, uncontrollable tears from some patients. So it was hard for the nurses who probably expected that when you are in a garden, you're supposed to be relaxed and happy. But actually, the way it works is that when people relax a bit, it can trigger the release of strong emotions that were bottled up. It's important for nurses and healthcare professionals to be able to welcome those reactions without judging them. So our second example is about a group of people suffering from social isolation. So with this group, the importance was to develop self-confidence, develop a trust in other people, and foster movement in both body and spirit. So just a few points about a session outline. So it was very important for this group to take some time to share their current physical and emotional state, and it could take a lot of time actually. During activity time, what was important is to leave them, let them free to choose their activities, to be alone or to be in a group. But freedom was really the main topic. So some key points. It's important with this kind of group to encourage personal choices. For example, when we are weeding, we let them choose which plant they want to leave and which plant they want to remove. It's also important to foster a sense of belonging and to make some choices collectively, like which plant we're going to sow. So with this group, non-directive approach is absolutely essential. And it also means that the garden will evolve according to what the participants decide. So person-centered approach here helped welcome participants in their often fragile physical and emotional states and to propose or adapt activities accordingly. Okay, so I'll skip the third example. It was people with cancer, but I don't have time for that. So to conclude, person-centered approach in horticultural therapy is a very positive combination. As Dr. Ulrich said earlier, the contact with nature helps participants to reduce stress, and it also helps them being more concentrated. A person-centered approach helps participants to mobilize their own resources and become aware of their needs. And the combination of both enables participants to be in very favorable conditions for therapeutic work. So both approaches are very adaptable and it can follow participants' changing needs. Okay, and to finish, a few points to keep in mind. So person-centered approach is simple in theory, but it requires training and a significant amount of practice, and it's the same for horticultural therapy. Both person-centered approach and horticultural therapy are accessible to non-healthcare professionals, and supervision is essential as therapists must have a deep reflection on their practice. And I think I'm finished.
І, здається, я закінчила.
So thank you very much. So maybe we can have a time for questions. I don't know if we do have time.
I'm Birgit de Boissezon, and I have two short questions. One is, do you have any initiatives in the southern France area? Because all the examples you mentioned were actually in the north and mid France. And second, is there a European level federation compared to yours? Or are you a member maybe yourself of a European level one?
Okay.
Maybe I can take the first part and you can take the second part, Laure, since you're more involved in the European level.
Yeah.
So maybe what we could suggest is that you go on the website, which we could put in the chat, of the federation, and it's organized, the directory of members is organized by regions or geographically. There are some examples in the south. The Jardins de l'Humanité, I mentioned in one of those of the out of the walls practices, is in the south, in the Landes area on the coast. And yeah, they are definitely, maybe we're very Paris-centered, the two of us, but there are definitely practices. So I'll put the proper page of our site to go and look at practitioners in the south, okay?
And for the second part of the question, there's no formal association in Europe that would look like the Fédération Française, but there's an initiative, it's a European group run by a German association called IGGT, and it's for the time being, it's more a discussion group where we discuss the training level that could be the same all over Europe. So we are comparing our practices and we are comparing our trainings between members. And I'd like to add that we're going to welcome a Ukrainian practitioner in this group. I think Daria has a question. I can see a raised hand.
Yes, I have a question. Hello. My question is about supervision. Who would be the best supervisors, specialists in horticultural therapy or psychotherapists or other kinds of experts?
Do you want to answer that, Isabelle? I can give also a part answer.
Yeah, we're always at the junction of those fields, right? So it's always a question. I think someone, as in any supervision, who has more knowledge and experience and perspective is always what's most important. So in this kind of situation, I think anybody who's got a lot of experience would be more interesting, whether they come from the health side or the horticultural side. Laure, do you want to add something to that?
I think you said pretty much. Another way of being supervised is, sorry, is to do pair vision. Je sais pas si ça se dit en... how would you say that? It's to just discuss with your colleagues who are doing the same practice as you do, and in a group. That's
intervision. I don't know if
vision,
it really.
Yes. Thank you very much. In fact, we are organizing an intervision group with horticultural therapists this Monday. It will be our first meeting, and I'm really excited about this meeting and our future experience. And thank you. You confirmed that we are doing the right thing.
Maybe I could add. Okay, maybe Tanya, if I could add one thing on what Dario was saying, is the reason for creating this association in France or others in other countries is to bring together people who do this job and who are often isolated because there's nobody else in their institution or in their area doing the same thing. So in every country in the world, horticultural therapists feel isolated, and every time they can talk together, it's good for everybody.
There can be different kinds of personalities. So again, passive who tend to not to take initiative, to take active actions. And there are people who can't stay at the same place for a long time. They need action, physical, they need to move around. Yeah, what can be the difference in the treatment, in the ways how to help these different categories of people?
Okay. So actually in the garden, you can accommodate both kinds of personalities. That's really not a problem. Because, for example, if you have somebody who is more passive, you can have only sensory activities, meaning that you can just invite the person to smell, touch, observe the plants. And then for a more active person, you can propose activities that can be very physical, like digging the soil, cutting branches. So you have really to walk along with the person and take into account their personality without forcing them. Sorry, could you repeat that?
The first category, passive.
Yeah,
they can serve as the supervisors or observers, enjoy the activities of the second category as a kind of spectacle at the theater.
Exactly. They can be just observers, and it would be beneficial anyway because they will be in nature. And as Dr. Ulrich said earlier, just being in nature has positive effects. And also they are in a way in connection with the others, even though they are passive.
I just want to quickly point out to Claire Cooper Marcus, or Marcus Cooper. You know, Claire Marcus Cooper was an American designer of therapeutic gardens who insists on the importance of those places, therapeutic gardens being both a place to be and a place to do. So both passive and active, they can be both in turn, and what people want out of it. And maybe one more thing is in mostly with senior people, there's a lot of programs for seniors in France that we have not discussed. I hear a lot of testimonials that people sometimes come and observe and little by little start doing. So it can be a process. It can be in time.
Are there any studies that study how different types of plants influence the people? For example, if it's leaf trees or it's fir trees or something, is there a difference how they influence the stress levels in the therapy?
I think I have a vague memory of some Scandinavian studies trying to look at the different influence and impact of different plants on people, but I don't have it at the top of my mind right now. But I think it's been done, and I think the Japanese also, in the Shirin-yoku approach, forest bathing, also look at different plants.
We will come a little bit on this subject in my part. So I will answer later.
Thank you, everybody, and thank you, Alexandra. Thank you very much.
Thank you. I'm learning so much.
Merci beaucoup. And bravo, Alexandra. It was not easy.